And
Hello, I'm Kollette. I'm going to be your nurse today. Can I get your full name?
Steve Jones,
And your date of birth?
9/22/88.
And Steve, are you married?
Nope, I'm single.
Have you ever been married?
Nope.
Do you have any children?
No, I don't.
And Steve, are you living with anyone or living alone?
I live by myself.
And what do you do for work?
I'm a tool and die maker.
All right. And are you currently on any medications?
None.
Any over-the-counter medications?
I sometimes take ibuprofen for like a headache occasionally or back pain, but not very often.
Okay. Any allergy medication or over-the-counter supplements?
I take a multivitamin.
Perfect. And do you have any allergies to medication?
None to medication, no.
Any environmental allergies to pets, outside, anything like that?
Pollen.
And how severe would you say the allergy is?
Very bad. My eyes swell up and get itchy, and the sneezes and stuffy, it gets pretty bad.
And what do you do when you have those allergic reactions?
Stay inside as much as possible.
Do you treat yourself with any kind of over-the-counter allergy medication at that time?
I usually don't like to, but sometimes I will take Benadryl in extreme cases, or if I have no choice but to be outside.
And do you have any food allergies?
None.
And what is the reason for your visit today?
It's just been a long time since I've been to the doctor, and I'm getting to the age now where I should probably start going a little more often.
Okay. Are you here on a referral from anyone? And currently, are you experiencing any illnesses such as diabetes, hypertension?
I know that my blood pressure has been a little bit on the high side.
Okay, when was the last time you had that checked?
Probably 6 months to 9 months ago.
And were you treated for that at that time?
No.
Do you have any childhood illnesses such as whooping cough, flu?
Other than just like the chicken pox, no.
When did you have the chicken pox?
I was in kindergarten.
Did you have any complications from the chicken pox at all?
Other than just itchy.
Did you have any mental illnesses such as depression or anxiety?
I had depression a few years back, but it kind of went away.
Did you seek medical treatment for the depression?
I did.
And what medical treatment did you receive?
I was on Wellbutrin for about 6 months.
Did you seek out any counselors or therapy for that?
Not at that time, no.
And any other past medical history that you have?
Nothing that's coming to mind, no.
And any major surgeries that you've had?
Other than my wisdom teeth being removed, I've never been under general anesthetic.
Any complications with your wisdom teeth being removed?
No.
And right now we're going to go over your family history. We're going to go 3 generations back to get an idea of what kind of medical history your family has and any concerns we might need to be looking out for. Can you tell me any major medical history your mother has?
She had hypertachycardia, I believe. It's a big, long word. Her heart would beat very, very fast, and she had a surgery to remedy that.
Okay, anything else for her?
Depression.
Do you know when she was diagnosed with that?
Probably 10 years ago, 2006, 2007. And she's a sociopath.
And when was she diagnosed with sociopath?
That's more recent. That's been only 5 years ago, probably.
And do you remember when she had the surgery for the tachycardia?
That was probably 1998.
And for your father, any medical history from him?
He's healthy as a horse.
And your maternal grandfather?
He has diabetes.
And when was he diagnosed with that?
Quite frankly, I'm not sure. It's been in recent years, I think. Probably in the last 10 years. He hasn't, well, perhaps he's had it forever, but he hasn't addressed it.
Okay. And how about your maternal grandmother?
She had breast cancer.
And what treatment did she have for that?
She had a single mastectomy.
Has the cancer returned at any point?
No.
And when was that?
Her surgery and care would have been in 2009.
Any other medical history for her? Okay. And how about your paternal grandfather?
He had prostate cancer.
And was he treated for that?
It was late enough in his life that they said the complications from that surgery would have not been worth the risk.
Okay.
That the doctor basically told him that something else was going to kill him long before that prostate cancer ever did.
Okay. And do you remember when he had the prostate cancer diagnosis?
2001.
And is your paternal grandfather still living?
No, he passed away in 2007.
Do you know the reason for his passing?
Heart attack.
Did he have any other history of heart issues?
No, just high cholesterol.
And for your paternal grandmother?
She had breast cancer as well.
And what was her treatment?
She had a lumpectomy and radiation.
And is your paternal grandmother still living?
No, she passed away in 2012.
Do you know the reason for her passing?
Just the age.
And with the passing of your grandparents, did you seek any counseling or therapy for that?
No, there's a lot of family around.
And for your sister, does she have any pertinent medical history? Really healthy?
Yeah, she's really healthy.
And how about your brother?
He's really healthy as far as I'm aware too.
Alright, now I'm going to go over your lifestyle and health maintenance. Are you a smoker?
Yeah.
How long have you been a smoker?
30, I've been smoking 25 years.
And how many packs a day have you smoked?
Back when I was little, it wasn't very much. It was, maybe a pack and a half a day, but now it's 3 or 4 packs a day.
Have you considered or tried quitting?
No.
Would you be interested in having anything done to help you quit?
Possibly, I guess. Yeah. I tried one of those vaporizer things for a while, but I don't like smelling like a fruit salad everywhere I go.
Do you use any smokeless tobacco at all?
No.
Do you drink any alcohol during the week or on the weekends?
Only on the weekends.
How many drinks would you say you have?
For the whole weekend or for like just Saturday?
When you sit down to drink, how many drinks do you usually have?
8 to 12 beers.
Do you drink any hard liquor?
Usually I'll chase every beer with a shot.
And how far back does your drinking go?
Well, I started drinking about the same time that I started smoking, so about 25 years.
Do you use any other illicit drugs, marijuana, meth, coke?
I've been off the crack pipe for 10 years or so now.
How often did you use crack?
As often as I could get my hands on it.
If you were to put a number on how many times you used in a week, how many times would you say?
30.
How long did you use crack?
Well, I've been off the crack pipe for 10 years now. Probably only 5 years of really heavy crack use.
And what helped you quit crack?
I found Jesus.
Did you find Jesus by going to church or support groups?
Well, his name was Jesus. He was my counselor.
Do you remember what facility that counselor was through?
The hospital up the road here.
What does your diet usually consist of?
I don't eat all that healthy. Eat fast food probably 2 or 3 times a week.
You have vegetables and fruit in your diet at all?
If you count the lettuce, tomato, onion on a burger.
Do you drink a lot of soda?
Coffee. Not very much soda, lots of coffee.
And what would a day in your life be like? Are you very active? Do you usually sit on the couch?
Somewhere in between. I'm on my feet all the time at work, but other than my curling tournaments and underwater basket weaving, I don't do a lot of physical activities.
Alright, now we're going to do what's called a review of the systems. I'm going to go through and just ask you questions about all the different parts of your body. In general, do you have any complaints about things you've noticed that have changed or recently increased? Any pain, discomfort?
I do have a little bit of back pain. Nothing major. And it's not consistent. It might be with me for a day or two, but then it goes away for weeks on end.
Do you notice that it worsens with physical activity?
It more depends on what I'm doing at work. I'm a little on the tall side, and a lot of the equipment that I'm using isn't made for a tall person, so I kind of have to bend over halfway.
Have you noticed any changes to your skin, rashes, dryness, cracking?
I got, I think it's athlete's foot, where my feet are really, really dry and scaly. I think that's from work boots.
About how long have you had the athlete's foot for?
Again, it kind of comes and goes. It gets a little worse in the summertime. Since high school, probably 15 years or more.
And have you noticed any headaches, dizziness, lightheaded when standing?
Not really, no.
And any issues with your ears, with hearing, popping,
What?
ringing? So you have hearing problems?
Oh, I'm a little bit hard of hearing in my left ear.
Any vision issues, floaters, blurred vision, anything like that?
I have to wear corrective lenses. I have astigmatism.
And nose, stuffiness, any kind of nasal congestion, sinus headaches?
Other than the reaction to pollen that I mentioned before, typically not much.
Have you noticed any a sore throat, any sort of discomfort when swallowing?
Nope.
Have you noticed any sores in your mouth?
Mm-mm.
Any loose teeth, any cracked teeth? Do you have your own teeth?
They're all my own teeth.
Have you noticed anything with your heart? Any sort of chest pain?
Not really, no. Other than my blood pressure, that'd be the only heart-related thing I could think of, really.
With your gastrointestinal tract, have you noticed any nausea, vomiting, diarrhea, constipation?
It swings between constipation and diarrhea. Almost daily.
Do you take any medications for that?
No.
Have you noticed any black tarry stool, any red streak stool, or chalky stool?
No.
Have you noticed any difficulty urinating or any burning sensation or urgency to urinate?
No, I can pee pretty good.
Have you noticed any changes to your genitals?
No, they're pretty much the same they've always been. Well, yeah, they're good.
Have you noticed any swelling to your legs, any pain in your legs at all?
No.
Now you mentioned back pain. Can you describe that pain to me?
Typically it's in my low to mid back, and tends to develop if I move in specific ways.
And do you take the ibuprofen for that?
Typically, only when it's severe. I don't take it very often.
Are you having any feelings of depression or anxiety right now?
Not really, no.
Any feelings of uneasiness?
I don't really like the doctor's office. That's why I haven't been around the doctor's office very much.
Have you noticed any neurological changes for yourself?
I don't have a lot of energy lately. Seems I'm a little unmotivated, I guess.
So you say you have a lack of energy. Do you have a lot of iron in your diet? Usually found in red meats and spinach?
Yeah, I eat a lot of red meat.
Okay, so that's all I have for you today, and I think we got a thorough history. Fantastic. Thank you so much for coming in.
Thank you.
All right, you have a good day.
You too.